Hi, good evening, everyone. And I'm Dr. Bishnu Panigrahi speaking from Fortis Healthcare. And we have esteemed panelists here. And the discussion is actually on looking at the winter coming in. And there's a lot of issues coming up for young, old, elderly. So this is the thing we thought that we'll get some of our senior doctors from across our network of hospitals, Fortis as well as clinicals, and put up a few questions to them to see how do we take things forward. So because this is a Facebook live session and this is something that Fortis Healthcare has been doing over the last nearly 1 year to sort of link up with public, take the opinion of our senior clinicians. So it is like the chai pe charcha, it is Fortis ke saath charcha. So there's something that we are very keen on. I'd like to start off with starting with not nothing to do with that, but because Fortis Hospital Mohali was the first hospital of Fortis Healthcare, and a disclaimer is that I was there when it started in 2001, so nothing to do with that. But I'm just taking because that is the place where the maximum winter is in our network of hospitals, and so we have Dr. Vikas Budani, our senior physician there. So Vikas, welcome to this Facebook live session of Fortis. So I'd like to ask you is that what are the common winter illnesses in adults, and how can we prevent them? Because this keeps coming up amongst adults, a lot of winter illnesses which are pretty recur every winter. So
Yeah.
what is your take-home message that you would like to give to the public at large, and even within the medical fraternity also? There's a lot of knowledge gap on that. Over to you.
Okay. Thank you, sir, and good evening, all, and good evening to all our listeners who have joined the evening session with us. And first of all, I would like to emphasize upon the fact whenever the winters come or the change of season is there are a couple of few illnesses which increase. Like the commonest illness which would increase is related to respiratory tract. Now, starting from respiratory tract, the first thing which comes is common cold during the change of season, and then comes the flu also, the influenza, which is commonly known as influenza. Now, the difference between the common cold and influenza is common cold is patient would have only you can have only some running nose, some mild body ache, some mild sore throat, and maybe a blocked nose. So that is common cold. And then influenza is something more serious than common cold is it's not serious at all, but influenza is more serious than a common cold illness. And influenza, especially in the elderly population or extremes of age, in the children can be really serious. Influenza predominantly different from the common cold. The fever is high grade. The patient would have a high grade fever, and body aches would be extreme. And then even in influenza, the things can even progress to lower respiratory tract, leading to tracheobronchitis and finally pneumonia also. So one should be very, very particular, especially when the patient is having comorbid illnesses. So they should be extra careful regarding the onset of winters and how they can prevent this. They can prevent influenza. Common cold, of course, you can prevent by keeping yourself healthy, by keeping your immune system healthy. But the influenza can even be tackled, or the incidence of influenza, or I'll say the severity of influenza can be drastically reduced if you have influenza vaccine that is an annual flu shot. It's not very common in our country, but of course, if you still look at the Western world, and if you look at the people who the flu shots are very, very common. In fact, the population is advised to go for flu shots, which is not out here. But I would still recommend all of you, or at least who are listening, or you can spread the message that during the onset of winters between September to one should have an yearly flu shots, which can reduce the incidence of influenza. So after influenza, the third illness, which I've already spoken about, is the lower respiratory tract infection. The patients can have pneumonias. Pneumonia is when you have a patch in the lung. Patch in the lung means infection in the lung parenchyma for people to understand. And pneumonia, again, pneumonia at times it can be mild, it can be moderate, it can be severe. So mild to moderate usually can be managed with it, and influenza the pneumonias can also be because of the viruses or bacteria. Again, the viruses can be of various types, and because the viruses keep on circulating in the air, and of course they change every season also. So viral illness largely it is symptomatic management, but for the bacterial infections. If you can isolate, if you can do a swab test, if you can sputum test, if you can isolate the organism, you can target your therapy accordingly for the pneumonias. And severe pneumonias, they have to be hospitalized. And people of I'll say of the respiratory illness, the extremes are like patients who are diabetic, patients who have coronary artery diseases, patients who have kidney diseases, patients who have chronic obstructive airway diseases, patients who are asthmatic, patients who are smoker, patients who are alcoholic. So these are the population who are especially risk for having these, you can say, moderate to severe form of respiratory illnesses. So they should take extra precautions of keeping themselves warm. And how you can keep yourself warm during the winters? Keep extra layering is important. It's not a single layer. The layering is important. And people who are in the habit of going for morning walks, and we advise that go whenever the sun, at least when the sun starts rising, at sun starts rising. So that's the best time to go for a walk, and keep yourself covered, and keep three things covered: your hat, you keep the hat on, keep your head covered, keep your face covered, keep your have gloves on, and go in shoes, don't go in slippers, and don't go without socks. So because if you keep yourself warm, keep proper layering, eat healthy, eat healthy, keep proper doses of fruits and vegetables, you maintain your supplementation as per the recommendation of the doctor in case your vitamin D and B12 are low, because all these things reduce immunity. And if you have take supplement, if you keep your vitamins, especially vitamin B12 and D3, which is there and part and parcel of every health package. If anybody is getting, so in case they are low, they must be corrected and kept to normal, because they also helps in building up your immunity. And of course, more importantly, keep less of stress, have proper sleep, take proper fruits and vegetables, and keep your prescriptions ready with you. Because what would happen if you have any of these illnesses, and if you have any of the comorbidities, what would happen? The things would go haywire. Like a patient of diabetes, if he gets any of these illnesses, the sugars would fluctuate, because any illness in a diabetic patient is stress on the body, and the sugars will fluctuate, the sugars would go high, and the patient would enter into a vicious cycle. If the sugars go high and the patient is having a form of pneumonia, again the things will be prolonged. Patient may need prolonged hospitalization. So my advice is keep your prescriptions up to date, keep your reports results healthy, and keep visiting your doctor, and have annual flu shots, eat healthy, sleep healthy, take proper rest. So these are the ways by which, and keep yourself warm. These are the ways by which you can prevent to a larger extent the respiratory illnesses which we
Thank you, Dr. Bhutani. A quick one just to reiterate to the public. You made a mention of taking the flu shot in September. Is that
yeah.
the optimum time to take it?
Yes, fall is the optimum time to take the flu shots. But yes, if
And
somebody has delayed, they can take during later part of the winters also. But of course the protection would not be to that extent as the patient the public would take in the
because
fall.
that's a very important message out to the public. And on pneumonia vaccinations, is there a role there?
Yes, the pneumonia vaccination, it is for elderly populations, like it's recommended for more than 65 years of age. And if you can have a pneumococcal vaccine, or if you have any comorbid illnesses, all those populations should have a pneumococcal vaccine. Now, it's not recommended for the for immunocompetent patients who are
And
less than that age.
any
But yes,
timing for that? Any timing for the pneumococcal
no,
vaccination?
pneumococcal vaccine has got no timing, can be taken off any time, but you should fulfill the age criteria.
Okay, thank you. Coming to Dr. Gurinder Bedi, one of the best orthopedicians in Delhi and a very good dear friend. Like to ask you something that because in winter, uh, there's a lot of discomfort as far as the elderly are concerned. So they keep complaining that joint pains. So taking it from that, how does arthritis discomfort, why does it increase in winter, and how can we help the seniors manage themselves better?
Thank you so much. Thank you so much for having me on this talk show. So, as far as the orthopedic practice is concerned, I hate to admit it, but the orthopedic practice goes up like that during winters. And it's mainly the elderly
You
people
can't
who
on
can you
mute.
hear me? Yes.
Yeah.
Okay, can you hear me? Okay, so the orthopedic practice goes up like that during winters, and it's mainly the elderly people who actually come back to us with so many of these old pains which were never really troubling them before, and suddenly they feel that they're totally incapacitated. There are quite a few reasons for that. One is that the fact that winters, most of us don't like the idea of getting out. So we're all sitting at home, we're all putting blankets and sweaters and everything. So mobility is getting restricted. Remember, there is a large percentage of the population which anyway are on the brink of having a problem with their joints. The lower their amount of mobility, the higher the disability increases, because the joint which was just working with that combination of that little movement, little activity, suddenly has crashed down and the patient is no longer walking. So the muscles have now got very stiffened up, the ligaments have got very, very stiffened up. The person, as it is very hesitant getting out of the house. So it's all actually, everything is coming to a standstill. And we know very well from years and years and years that the only way that the musculoskeletal system works is if the patient can actually be mobile, which is essentially what orthopedics is trying to keep the patient mobile. The other thing is there is a vasoconstriction as happens, which is there's a squeezing of the blood vessels in the periphery to prevent heat from being lost. The problem with that is that nutrition to the muscles, to the joints, to the ligaments is all reduced. So these patients are not getting the kind of nutrition that they would like to have. The third thing, I'm sorry, I hope I don't take too much time, is the fact that our exposure to sunlight actually goes down. So remember, pollution has gone up. The amount of hours available for exposure to sun have gone low. Our mobility has gone low. So the vitamin D synthesis in the body is not happening at all. So vitamin D, as we all know, is very important for both the muscles and the bone. And if the vitamin D synthesis, you compound it, other thing goes up, that's a bigger problem. So Delhiites and Punjabis know that winter is the eating time. They love their food in winters, and they just go all out. Actually, pretty much everybody puts on weight in winters. That's another thing which is actually against all these people. So now let's talk about what can you do for yourself. The answer is do not give up on your activity. As we've just heard very, very elegantly and eloquently, walking, standing, getting out of the house is still number one. You really need to get outside. I know the air is very, very poor. If it means take a mask, take a mask. And remember what was said just now, go when the sun is out. Don't try to head out 6 o'clock in the morning where the air is very, very poor. There is no sunlight exposure. So stay warm as much as you can, dress up as warm as you can. You got to maintain some level of activity. In our country where yoga is becoming so popular, even doing a Surya Namaskar 10 times in the morning stretches your body out. So don't just pull back because it's winter kind of a stuff. So remain active, cover up those joints which are aching you with some warm thing, maybe even take some warm packs or something, maintain your mobility, find a different way to maintain your mobility. It doesn't need to be that you have to go out in the park. Go and buy the milk, go and buy the vegetables, potter around as much as you can. You'll be very surprised how much more you can actually do just with simple mobility exercises which you can do. Joints love movements. Keep it moving. Make sure your nutrition is fine. Don't put on weight. Exercise as much as you can. Stay warm. Stay away from illness. Develop an attitude that, look, irrespective of the temperature, I'm going to do what is good for my body. So don't hold yourself back. And I'm sure you'll have a very, very enjoyable winters, the bad air as it might be.
Thank you. And I moved to Chennai and wishing Dr. Ashwin a Malai Vanakkam. I learned this when I was there in Chennai over the weekend, and it is good evening. So, Dr. Ashwin is a senior physician with us at Clinical Cell City, which is a partner hospital of Fortis Healthcare. So, welcome for this program, Ashwin. So, would like to ask you is that why do diabetic patients experience sugar fluctuations during winter?
Thank you, sir. Thank you for welcoming me. And I'm happy to be among the Fortis Network hospitals now, which is one of the largest in India's premium institution. And as my preceders, Dr. Bikas and orthopedician who has already spoken much about it, what I basically understand about winters and the diabetes is winters doesn't change diabetes, but habits do. So our habits change during the diabetes, the whole forum. It's not about the winters or the summers, it's always us. And I think when you see in winters, basically the insulin sensitivity is reduced. One reason is because the stress hormones are quite high. cortisols, catecholamines, and all of that has a lot of pressure over the body. And that leads to higher fasting and postprandial. That is the main insulin sensitivity which goes down. That's why we need to increase these insulins in most of these patients. And as sir rightly pointed out before, less physical activity. See, we always find ways to say why we don't do a physical activity. During the summer days, we say it's too sunny. During the rainy days, we say it's rainy. And, during the cold days, we again have an excuse of it. But then people who really do activity, they continue to do it. And mornings are, shorter days and colder mornings. And as sir rightly pointed out, there is always this vitamin D deficiency where there is a joint stiffness and workouts are reduced, fewer walks, can't go in the early morning. So there are some routine which actually takes a toll on it. And then we should agree, winter is always about eating, festival patterns. What not we have during winters, we have all the festivals which are coming up in winters. So high refined carbohydrate is one of the biggest problems in this season. Fried food, sweet food, and always you have this comfort eating. We all know that whenever we have a winter season, we always would like to eat more and more, and thereby you put on weight, and that's a very very common thing to stay, to stay warmer, and that's what it is. And of course, alcohol intake goes very high during the season. And it's very surprising to see that people who have diabetes uncontrolled are binge drinking in most of the cases. And especially not only in the north, even in the southern states, they always feel that alcohol, brandy, whiskey, and all that takes a lot of toll on these patients. So that creates a lot of problems. And of course, infection, as Dr. Vikas has rightly pointed out, you have to take your vaccination. We recommend all the diabetic patients to take flu vaccine, pneumococcal vaccine, which protects you. If you take both of this, 90% you're protected from most of the pneumonias. So that is one reason. And when you get pneumonias, your stress level goes high, and again, there is a sugar fluctuation. And one of the most common things which have been overlooked is hydration. So when winters, you don't take adequate hydration at all. You don't drink adequate water. So what happens is there will be a hemoconcentration, which can show a spike in the sugars. That is why during the summers and during the winters, where you don't take adequate fluid, due to hemoconcentration, you see that it's going up. And that's how the blood sugars most of the time picks up higher. But then you see when you come to the HbA1c, it looks more or less under control. And of course, altered sleep. Whenever you have high fasting glucose, when you eat late at night, there will always be a poor sleep cycle. And the whole circadian rhythm somehow changes to these winters when you don't do your regular routines. And I think that is the most common reason where we see this diabetes going up and down. And if you could change the habits and keep up the same kind of habits most of the time, I don't think so you should be worried about winters or summers. Your sugars will always be slow and steady.
Thank you, Rafin. Now coming to Dr. Sejal Seth, she's a senior pediatrician at Fortis Hospital, Mulund in Mumbai, the financial capital of India. A very interesting thing is that we celebrate Children's Day on 14th of November, and after that winter sets in, and then we see kids suffering from various illnesses. So what winter infections are most common in children?
I think, good evening, everyone. Thank you, sir. The infections are more or less like adults only. So, in winter, we can see two type of the things more commonly happening among the children. One is infection, and second is the allergies also. It can be because of the exposure to cold, change in the habits, as well as very crowded situations because people stay more indoor and mobility is less. Very common infections are like influenza, RSV, non-COVID coronaviruses. Sometimes we see even some mosquito borne illnesses like chikungunya, dengue virus. Respiratory illnesses are more common. The children can present with upper respiratory infections, lower respiratory infections. Even the cold can trigger the allergies and asthma. So you see children presenting to us with different symptoms like ear pain, ear discharges, throat problems, throat pain, and fever, sometimes lot of cough, even bronchitis are not uncommon. And nowadays, particularly in the metro cities, we are seeing a rising trend of allergies, and they are triggered by either the infections or the cold weather or the pollution. So it is multifactorial. Many parents commonly ask us in the OPD, can we give any immunity boosters? And many children are worried that having recurrent infections are a problem in the children. I always tell in a lighter note that we should always celebrate the infections as far as we recover, because just like the COVID infections, the bodies are making the antibodies, and such to an extent we cannot prevent these infections. So as far as we take the symptom relief medications and get better in 2 3 days, I think it is okay. But at the same time, what we can do to prevent these infections, and that is basically exposure. It is very hard to prevent the exposures for children because they go to schools. So in the school, they are compressed in a small classroom, multiple children are there. So if few children get the infection, then it's very easy for them to transmit the infection from kids to kids in the school environment, in the buses, in the sports activities. What parents can do, I think it is a universal thing. Good habits, good nutrition, good hygiene, adequate sleep, all of these things certainly affect the immunity. We can The Indian Academy of Pediatrics recommends the children less than 5 years of the age to take influenza shot every year, preferably, and especially as those children who are immunocompromised, like those who are undergoing treatment for the chemotherapy or malignancy or transplant. Those children or the asthmatics, they can also take the flu shots, which is basically inactive influenza viruses. Um, we also can prevent the children to go to school if they have a respiratory infection, so that they don't infect the other children. I think this is all we can do. Winters are beautiful. We can enjoy by remaining mobile, eating well, not overeating, and taking vaccines, and hydrating ourselves very well. I think it is a very said point, which commonly we also forget and children also forget, is the hydration. Because if it is summer, we are anyway inadequately hydrated, but in the winter we forget to drink well. So I think reinforcing repeatedly for the children to consume adequate liquid is something we should be keeping in the mind.
Thank you, Dr. Seth. Coming now to Dr. Vikas at Mohali. So, Vikas, how does winter affect people with conditions like diabetes, asthma, or hypertension?
Okay, sir. I think we have touched all of you. In fact, diabetes has been touched in detail, but I'll again come to the point. So, diabetes is one thing. Of course, the because of the lack of physical activity in winter, because which we all people have been talking of, and increase in eating in the sense increase in eating can be because of the one, because winters are, you stay indoors, you want to keep yourself warm, to start eating. Even the diabetic, they would love to have some sweet or some halwa or something like that after the dinner, so they would love. And then the wedding seasons, all the predominantly Indian wedding season is in the winters only. Yeah. And so all this puts together a load on the patient's sugars, the glycemia, the glycemic variability is more, and the sugars go up. And then so what you can do is, one, eat healthy. So we have been stressing upon all this, keep the physical activity alive. So even if you're not able to go out, I think a very important observation, what a very important thing has been pointed out, that you do yoga is very indoor, but at least you can stretch all your muscles. You can stretch all your muscles. So 10-15 minutes of yoga or pranayam, if you pranayam you can do at home, even not going out in the winters. So you can have your muscles do some activity, mobilize the sugars, so that the sugars remain okay. And of course, keep your prescriptions ready. As I've said, keep your prescriptions tight and ready, because that is also one very common problem which you come across. There's the medicine, whilst the medicine got empty, or there was no insulin, because I went to a wedding, I went to something else, some destination wedding for 2 days, I forgot my medicines. So very commonly you come across these explanation given by the patients, because of which the sugars fluctuate. So if you can keep your prescription ready, keep yourself, eat healthy, and do regular physical activity, the sugars can remain okay. And one thing important, in winters, don't keep your, because of the freezing temperature, if even in indoors at times, don't keep your the insulin vials outside, because insulin vials, they have to be stored at a particular temperature. If you're keeping in a minus temperature or freezing temperature, the things, the insulin can get, the vial, the insulin can get destroyed. And if the patient is using that insulin, especially in people who are on insulin, the sugars can fluctuate. So these are the important things which a diabetic patient has to keep in mind. And then comes regarding the hypertension. Now the BP, again, if you see, because of the increased peripheral resistance, there is some increase in pressures. And then of course the reasons are the same as we have in the habits, like eating more, doing less of physical activity, eating more of salty foods, because when you're eating out, the salt consumption also goes up, eating more of preserved food. So all these increases the salt intake, more, less of physical activity increases your pressures. So that is again a common that you come across patient in which you have to increase the dose of antihypertensive at times during the winter season, because the pressures go up. They start complaining of headache. They start getting shortness of breath. So you need to look at the prescriptions of these patients, especially when whom the BP fluctuates, not because of the habits, but per se also because of the winters, also because of the increased peripheral resistance. So you have to increase the doses of antihypertensive by 10 to 15% or 20% at times. But again, everything has to be done in consultation with your physician. So don't do yourself anything on your own. You can only what you people can what people can do is that, of course, maintain a healthy, balanced lifestyle throughout the year. Of course, this is a resolution now. This is the last week of the year. So there would so many resolutions which you see, which will come across with the patients in your family, that from first of this we'll do this, but nothing actually happens. So nothing actually happens. So this is the lifestyle modifications is the most easily set, but very difficult to achieve and very difficult to sustain and maintain. The drugs are easy to take, but even then people miss on the prescriptions. So that should not be done. Both the things should go hand in hand. And then comes the asthma, third part. People who already have known asthmatic disease or known chronic obstructive airway disease, you see lots of patients coming with acute exacerbations. Now, why these exacerbations occur? Because of, again, the dry air, because the patients moving out of the winters, not keeping proper layers on, and more importantly, people who are asthmatic and and having chronic obstructive airway disease, they're not using their regular inhalers, or they are not starting their, you can say, anti-allergic and mast stabilizer beforehand, which ideally should be in people who have acute exacerbations. So again, the advice is to keep themselves on regular inhaler, patients especially who have chronic persistent asthma. So normally what happens, most of the people would stop the inhalers. They stop the maintenance doses also. So if they're taking their regular maintenance doses of the inhalers or nebulization, whatsoever they have been prescribed by their doctors, I think the attacks would come down significantly. And of course, don't move out in extreme, you can say, very early morning at 4 a.m. Don't go out for walks. This is not a heroic job. In fact, one can land into problems. Go whenever the sun rises. And then same is true for the evenings also. So try to find time for yourself, and find the perfect time when you need to go out. And whenever you have to go out, of course, keep layering is important, and of course stay warm, keep these diseases away from you.
Thank you, Vikas. Dr. Gurinder Bedi, orthopedician from Fortis Hospital, Vasant Kunj. Uh, we often hear about falls in winters and having, after that, sustaining fractures. So, what precautions can help prevent slips, falls, and fractures in winter? What's your advice to the public?
Okay. So one thing, just out of context, or this question is, I think one thing I've seen is all of us are pretty much on the same page with what you should be doing, which is just to re-emphasize the fact that the body is one unit. So you need to nurture and look after that unit as one unit. Yes, we know we are trying to sort of disclose it, come at it from other angles, but just to sort of add a point to this. So a lot of it is repetition, but it's so important. Everything that we're re-emphasizing is, I know somebody would say a lot of repetitions, but very, very important to follow everything. Remember, the body will act as one unit. So the elderly are very, very prone in the winters for falls. There are lots of reasons which have been prescribed. So we know that a fall is it can almost be a almost be a mortality event for that individual. One thing that can happen is you can have a head injury. Second thing, which is much more common, is the fact that you can have a bleed somewhere which doesn't stop because of all the medication that you're on. And more for somebody like me, the chances of getting a hip fracture, a vertebral fracture, wrist fracture are so high, it's unbelievably high. In the West, where they have a lot of snow and everything, the any person stepping out in the snow or something, just a small fall will actually break the wrist. And remember, osteoporosis is an undetected, it's rampant in our country. So there's so many people who are just managing well, but just that one little slip is all that it takes to break a hip, or to fracture a vertebra, or to get a wrist fracture. The consequence of a fall is immense. You take away that person's independence almost completely, they lose their confidence. They're always then worried about stepping out of the house. Their health goes down, their muscle strength goes down because they're mobilizing less. They're actually even more incapable next time of balancing themselves. So balancing and falls go hand in hand. And again, there's a lot of etiology to explain that. So how do you prevent that in the elderly? One thing that needs to be done is stay warm, but don't go around wrapping blankets and shawls and everything. Much better to layer yourself, as Vikas was just telling us. Multiple layers, much better, keeps you more mobile. That blanket tripping over the blanket, catching that shawl somewhere in a chair or in the sofa, then falling, is a big no kind of a stuff. So have a functionally warm attire, not like dive into the quilt kind of an attire. Thing is nutrition and food. So all we said is, the carbs are not really helping out that much. So make sure you get your supplemental vitamins and essential proteins. You need to make the nutrition. Don't get overpowered by the wedding culture, the party culture, which is rampant. Cut down on your alcohol. Alcohol in winters is actually a very deadly thing to happen. But maintain your nutrition and stay hydrated. I'm emphasizing it again. Other people have also said it. Hydration is paramount in winters. Many times people will go through the full day without even having a glass of water. They will do the one tea, two coffee, or something like that. Exercise routine must. Just because it's winters, don't give up on your exercise routine. You need to find a new way to exercise yourself if you think the pollution and the cold is too bad. Low impact exercises, aerobic exercises, yoga, etc., makes a lot of sense. Wear shoes. Shoes gives you so much an ability to stand and be stable. It's actually unbelievable. And if you think, look, I'll struggle with doing things, get a some walking aid, whether it is a walking stick, a walker, or something. Get rid of those carpets which are with loose carpets floating around. Doesn't really help at all. So make sure that you have wear shoes, make sure you use a walking aid, make sure you balance yourself before you stand, move your hips and all, stand on your toes, stand on your heels, stand on one leg, stand on the other leg, stretch your back, then get to walk. A lot of people will get slightly dizzy when they stand up. So it's a combination of few things which you need to do, and you do that all the way through, you'll have a very safe, enjoyable winters.
Thank you. Uh, Dr. Ashwin, asking you is that what winter diet and lifestyle habits will you advise that will help build up the immunity and also control your sugars?
Yes, it's the important things what you need to do is very simple. High fiber diet, that is low sugar. Take more of ragi, jawar, bajra, oats, barley, pulses, and grains. These are the ones which will make you keep full. That is number one. And it will also control your sugar spikes. And it is high in high fiber, carbo-rich diet. And then the one important thing I see in most of our patients, especially diabetic Indian patients, are protein deficiency. They are all sarcopenic. That means literally their muscles are very lean, and they don't have the strength to burn it out. One reason is many people don't know how much should you take as a protein diet. So if you see, the average recommendations for most of this is being given very simple as 1 gram per kg body weight. That means if you are 70 kilos, you have to take 70 grams of protein, which never happens. So make sure you take adequate protein in the form of egg, paneer, chicken, fish. Avoid red meat most of the time, dal, sprout, tofu if you're a vegetarian. So it's going to help a lot. And enjoy these seasonal fruits like citric acid fruits, which basically increases your immunity most of the time. And if your sugars are well under control, there is no fruit restriction as such. So the only thing what we tell our patients is to restrict on those fruits which are high in sugar or which are high in glycemic index, and take a lot of nuts. You can also take turmeric powder, ginger, or garlic, which also improves your immunity to a certain extent, which is very common in our tradition to use these. And take clear soups, like in the sense that we all know that during a winter time we always like warm drink. So intentionally hydrate yourself. Take clear soup, dal soup. You can take herbal tea, you can take ginger tea and whatnot, and keep yourself more hydrated. So what not to do? Avoid sugary drinks, especially with sugar, tea, and coffee, most of the time, which we try to keep warm. So always try to keep that fried foods, snacks, pakodas, bakery items, all that needs to go off. And then also make sure excess rice at dinner is basically avoided. And as I initially pointed out, alcohol definitely is a no-no, because it not only spikes the sugar, what worsens is the nocturnal hypoglycemia. These patients go hypoglycemia, that means the sugar falls really bad during the night because of the metabolism of alcohol. And apart from which, the simple thing is keep moving every day, at least 30 to 40 minutes, brisk walking, yoga, excellent. We have all stressed upon yoga, how it is, it's a very good exercise to stress all your muscles. Warm water, herbal teas, soups, and fixed sleep timings. Avoid late dinners, and probably monitor your sugars more often at home, especially at least 2 to 3 times a week. Keep a track of it, because that's what is going to help you, do the dose adjustment and reviewing the trends, and at least you will know what happened. And the most important one, if you have not taken your vaccination, please go ahead, immediately do the vaccination, because vaccination saves a lot of life. With all this, I am sure that you will have a fantastic winter ahead. Thank you.
Thank you. Dr. Seth, coming to you, how can parents strengthen children's immunity safely during winter? Because taking off from what Dr. Ashwin mentioned about the immunity part, is there anything different that we need to do for kids?
So there is no magic medicine like immunity booster. Kids need to be probably well disciplined in the form of good sleep, good hydration, good nutritious food, timely vaccines. If they are younger than 5 years old, then they need to be fully vaccinated. Up to 5 years of the age, they should be taking the yearly flu shots also. Apart from that, just the cold weather precautions, like multiple layers of the clothes, if they are getting exposure to the cold weather. Those who are allergic, they need to stay away from the allergens if they can identify. And the children who are asthmatics, they again, if they have recurrent exacerbations, they need to consult the pediatrician again to be on the preventive as well as the therapeutic medications. I think children go to school and they are always having exposure to the loud crowds, bigger crowds in the classroom environment. So you can prevent your child going to school so that your child does not infect other children if your child is having any kind of the respiratory illnesses. Hand hygiene is very important. I think we need to repeatedly train the children to wash their hands before they consume their food. So basic hygienic habits are very important. And most importantly, vaccinations need to be completed in children.
Thank you. We are nearly coming to the end of this session, Facebook Live session. It's a Fortis ka doctor ke saath charcha, if I can call it, like the chai pe charcha. And I think so. Some very important take-home messages have come out. I think so. One is very important is that be active. Don't withdraw yourself because we are in winter. Keep yourself properly clothed in layered, not wrapping a blanket or a quilt around you and tripping. So your hydration, your food, vaccination is another thing that we have not focused much. If you look at public at large, and the timing is important, as was mentioned for influenza vaccine, taking it before winter sets in, sometime in September or so. That's the ideal time. But those who have not taken it, they can take it later also. but the efficacy is obviously better if you take it earlier. Pneumococcal vaccine also is there, and for kids, as Dr. Seth rightly mentioned, taking all the vaccinations are also important. And I really appreciate some of the other things that came up. What we call the grandma's concoctions, the turmeric, the ginger, the tulsi. I think so. Let us not forget about that. And I mean, Delhi, in fact, if you look at it, a lot of elderly parents say sometimes when you fall down or you're sick, they give us milk with ginger powder in it. So I think so. Those are another just take home messages. So in general, I think so. It's a good session that we had. I would like to thank all the esteemed panelists here for joining us and giving us some tips. Gurinder, go ahead.
There is some questions which have come out. If somebody can later maybe answer it, anybody whose question it is can maybe answer it in the chat box only.
Yeah, anyone, whoever can go turn by turn.
I guess one of them is related to the blood sugar levels. I think we've been able to answer that fairly well. The other one is how to prevent the winter climate related to pulmonary infection other than flu infection. We've managed to answer that, Dr. Panigrahi?
No. So, because if you could say that, how to prevent the winter climate related to pulmonary infections other than flu?
So I
Would you
think,
like?
I think for this we have already mentioned that take the vaccinations. Take the vaccine at the right time, and then try to people who already have the other infections would be the apart from flu, there would be viruses and the bacterial infections. So we can always prevent those infections by keeping yourself healthy, by keeping a healthy balanced diet and keeping your immunity up to the mark. Because if you are immune, if you have a healthy immune system, you would easily tide over these infections, and you can prevent this infection by not moving out in the crowded places, maintaining a proper hand hygiene, wearing a mask, as we have been all doing during the COVID, all the respiratory protection and the precautions which we can do to prevent other pulmonary infections apart from flu. But mind you, all these infections, all the respiratory infections, they are only by the droplet. They are all droplet infections. So if you come in contact with a sick person, try not touching you. If you've shaken hand with that person, try wash your hand first, sanitize, and don't touch. Avoid touching your hands to your face and nose. And people who wear specs, don't touch your specs again and again, especially because that's a very common cause of the viruses going through the nasal respiratory tract, through the nose. Because anything which enters the respiratory tract through the nose is going to cause some infection in case it bypasses the system, bypasses the tract and reaches up to the lower respiratory tract and so on.
There was one question on the chat box that we should have included a cardiologist. My apologies to those listening, and that we couldn't because we couldn't. They were occupied, and some emergencies also came in. So I'll put it to Vikas. If anyone wants whoever has given that question, if you have anything on anything heart related, Vikas can answer it. He's a senior physician in a busy center in Mohali, which has a lot of cardiac issues. So if you have any question, you can put it up on the chat box. We are free to answer it.
Yeah, we can take. What's the question, sir?
No, they just mentioned that you should have had knowledge to the panel. So I was putting up, is there any heart related question that
Yeah, definitely. Even the heart-related illnesses, they go up because of the cold season, because the incidence of all coronary artery disease cases, they go up. The incidence of the CCU admissions, they go up. The anginas, they go up. The heart failures, they go up. So you can prevent them again by not moving out in extreme cold, keeping your prescriptions up to the mark, and of course visiting your cardiologist or the physician, whoever is taking care of you, regularly, at least before the start of winter, so that in case any fine tuning or modification needs to be done, that should be done. And don't miss on the prescription, because the data, if you look at it, of all the diseases, you talk of diabetes, you talk of hypertension, despite people who are taking medicines and the on goal at targets, the less than 50% of the population is on target. That too, I'm taking on the higher side, but the situation is even greater than that. The only 30 to 40% of the patients, they are on target for talk of all these chronic illnesses. And these chronic illnesses, as Dr. Saab rightly pointed, the infections are one thing which come and go, but the chronic illness, they are going to stay with you throughout your life. So don't miss on prescriptions. Follow the precautions. They are very, very important.
With that, I'd like to, there are no more questions. I'd like to end the session today. So thank you, everyone, and namaskar from Fortis Healthcare. Have a good day. Protect yourself. Play safe. Merry Christmas. Happy New Year.
Thank you so much.
Thank you.
Thank you so much.
Thank you.